Okay. Welcome everybody to StartEngine's latest investor webinar featuring Adnan Malik, CEO of CallingDr. I want to give all of our attendees the ability to trickle in. So we'll officially start in a few minutes, but I wanted to just welcome everybody who's joining in with us as we speak. Adnan, how are you doing today?
Pretty good, thank you.
Good. I'm glad you could join us.
Yes, thank you. Thanks for this opportunity.
Of course. So for those who are joining us today, this is part of our latest webinar series featuring each campaign on StartEngine once they reach past $500,000 raised on StartEngine. So it's only a select few companies. It's the companies that our investors are most excited about, and we want to give the founding team the ability to speak directly to our investors, ask any questions that they might have should they decide to either invest for the first time or reinvest into CallingDr. So I want to get started just to give everyone context to the webinar's format. I'm going to start with about half of our time. We have an hour allotted, so about 30 minutes with Adnan. I have questions prepared here based on the campaign page and the vision and the growth of the business that I'll have him ask. It'll be a back and forth with him and I. And then please, there's a chat button for everyone who's joined in with us. You can ask questions throughout our I will be asking your questions to Adnan directly. So you'll be able to have your questions answered directly by Adnan. But let's get started. Adnan, I always love to get started with this question. Talk to us about how this all came to be. What was the problem you're trying to solve, and how did you actually move forward with the idea of starting CallingDr?
Okay, thanks, Alan, for the opportunity for us to share our vision with you, with all the shareholders. CallingDr came into being, we live in Florida. So in Florida, we get a lot of hurricanes and stuff. So this idea came to us based on some of the difficulties we had back in few years back when we got 4 or 5 hurricanes back to back, and the accessibility to healthcare was very limited. So that's how it all originated. But my background basically is in health IT. So we basically decided we did some research, found that telemedicine is up and coming technology. The adoption is very low in the United States and the rest of the world. So why not just master this platform and give an end-to-end solution for consumers and businesses.
And so when did you start CallingDr?
The project was conceived in 2015, but we started working, we launched the beta in 2017 in ATA conference, American Telemedicine Association conference in Orlando. And then after that, we just started developing this product. So it started with just one telemedicine product, but now as we go along, I'll be able to explain. We have a complete solution, a telehealth solution, which covers wide area of health space. Answer is 2017.
Yeah. We'll definitely have time to get into that, the vision for the company. But first, you mentioned the market of telemedicine. Do you mind sharing where you see the market and definitely, obviously, the opportunity that you identified before getting into this type of business?
Yeah, so with the 1% market space, the penetration is about 1%. You can say 1.25%, and the market is only at 18 billion, right now, 18 to 19 billion, and is continue to grow to 25 billion in the next few years. to make it more affordable and more appealing, the government has started giving incentives. Like for example, Medicare right now does not cover telemedicine reimbursements in most cases. Next year, in January of 2020, they are going to start introducing payment plans for Advantage customers. So as the adoption is getting there, we see this potential to grow exponentially.
And so, yeah, I mean, let's get into the products that you have. You've identified this market. Right now, talk to us about the current stage of the business, what products you currently offer, and the vision for the business moving forward.
Okay, great question. CallingDr is basically our main flagship product. We started, that's a telemedicine product, which gives an opportunity for a patient to connect to any doctor, who is on our platform. So that's a HIPAA compliant, high-tech compliant product, which means that their information is secured and it's safe. They don't need to worry about, some of the security issues which most people don't want to deal with on the phone. And we made this product accessible to all. So whether you have an iPhone, Android phone, laptop, iPad, anything, any device, you will be able to connect to your doctor. So that's the beauty of the product, that you don't need any special software to download. You download the app and you are up and running. You don't need any drivers, because all you need is a phone with a camera, So any smartphone basically will be able to do it. When we were developing this product, a few of the doctors who were doing beta testing with us said, how cool will it be if you guys come up with a platform where people can find us, the telemedicine providers. So that's when we started working on a product called CallignDr. Now, CallignDr is a very unique product because not only we will give access to patients to connect to the doctors using telemedicine, but they will be able to book their appointments for face-to-face appointments, as well as we will be offering premium appointments. What that means is that if they want a doctor of their choice right now, without waiting, then they will be able to make a payment and connect to their doctor. And in future, there's a third product, which is a combination of these two, called CallingDr on Demand. And that's the one I'm talking about, which will be able to connect the two platforms. Now, what's the advantage? Well, we are offering this product to consumers through CallingDr. So we are helping them connect to the doctors, and we are providing the platform to the physicians. So we are doing business to business and business to consumer. No other company I know right now does that as extensively as we do. And this is all done on our native platforms. We are not leasing any products. We're not white labeling from any other company. All this is our native in-house development and R&D.
So of CallingDr, FindingDr, and VisitingDr, what is the main driver of the business? What are you focused on right now?
The main idea behind all this is to make healthcare accessible for all, at a reasonable cost. Right now, what we feel is that some areas, some urban cities, for example, people who live there, they have better medical access than someone who lives a few miles away outside the city in rural areas or whatever. So to make it more accessible, I think this is the way to do it, because most of the doctors will not go to some of these areas, on a regular basis. And what they will do is basically, what they will do is they will connect to the patient can connect to the doctor, whether they are like 50 miles away from city, and they can get to a specialist also. And that can be a good revenue stream for doctors, for example, as well as it gives them access to the patients to see a doctor. So the idea behind all these products was to make sure that healthcare is accessible for all, and to make it more affordable, obviously.
And so,
But
Adnan, what is your background? How'd you get into this type of business?
my background, I'm an engineer by profession, so I have a degree in electrical and electronics actually, and I work for a company called Symantec for over 22 years. I took an early retirement and then established this company called My Apps with two co-founders, and the idea was to give access to provide medical products for the business. So we did some EMR products, we did some other projects, health IT projects, and then decided to develop our own. So we still are offering services through our company for healthcare projects. And we also do white labeling, which is another one which I don't think many of our shareholders know, but we have done a couple of white label projects with hospitals and stuff. And what we are trying to do is that we will lease out our products and white label, they put their logos, and they can sell it to their customers, So that's a good revenue stream for us.
Great. Well, let's talk about growth right now. So with CallingDr, simply walk us through how many physicians you've signed up, how many practices, and what your strategy for growth is moving forward.
Sure. So at the moment, we have about 50 odd practices. When I say practice, it's slightly misleading in the sense that each one practice can have one physician, or they can have multiple physicians. Like one of the practices we have has 12 physicians. So we have about 50 plus practices, and our main idea about this fundraising through StartEngine was to develop a good sales force, because we believe that this is a product which will not sell over the phone. You cannot pick up the phone and call a doctor's office and sign them up with telemedicine. You have to sell the idea, you have to demo them, you have to show it to them. So we have a direct sales force right now, about 30 odd salespeople in different states. And our growth is from 7 states to going for all 50 states. That's our main idea, that we are presently in 7 to 8 states. Why not grow it into all 50 states? And
primarily, which states are you in right now?
We are in Florida, Texas, Arizona, California, Kentucky, Alabama, and I think South Carolina. Yes. So.
And so on the flip side, can you walk us through the patient engagement through the software? How many patients have been treated? Do you have metrics on that?
We do have it, but actually each doctor has a different volume. So some doctors see about 10 to 20 patients, and some see about 30, 40 patients. So you can say about 10,000 plus patients have used this so far, Because most of the doctors on board are not doing full time, using telemedicine. What they do is they do 8 to 4 regular clinic, and then 4 to 6 or 6 to 8 or something like that, they do telemedicine. But we are signing up with a couple of urgent care centers who the whole business model is 24/7 access through telemedicine. So those are basically doing it. And our business model doesn't actually show any growth potential or nothing with patients. Our main model depends currently on a physician. A physician, when we sign up, because we don't charge anything from the patient. For the patient, whatever the physician is charging, that's what they are paying. We basically just charge a flat service model, flat fee through the physician's office. That's it.
Got it. Okay. And from just my last question on your growth strategy, on the campaign page, you mentioned that you're looking to expand internationally into Australia. Do you mind sharing a little bit about your plans there?
Yes. So we
Why
have
Australia?
Good question. Thank you. Yes, we do have negotiations going on with UK, Australia, and even Middle East, where they're for second opinion. they are saying that sometimes a patient needs a second opinion, so how do we get that? So we are working on two different platforms. One, we are going to promote telemedicine in those countries. Secondly, if those countries, the patients need a second opinion, they will be able to connect to their physicians in US or anywhere in England, for example, using the same technology. So the second opinion is gaining a lot of traction right now, because a lot of people spend money, travel, come overseas just to get a second opinion. Well, if the file is transferred electronically to the physician's office, and the physician can guide that patient and their family what the best course of action is over the phone through telemedicine, why not? That will save them thousands and thousands of dollars. So
are you saying your first visit might be in person, but that second opinion could be through telemedicine?
Yeah, so like any country where healthcare is not, the physicians are not that well equipped, they don't have good equipment, or they don't have good knowledge. Basically, what I'm saying is that they will go first to their physician of choice, correct?
Right.
The physician says you need a surgery to get this cured. Now, before going through the whole process of surgery, why not get a second opinion? And if the patient can connect to a doctor here in the United States, for example, and who's a specialist in that area, and basically guides them that, okay, yeah, you don't need a surgery at the moment. Why don't you try this or try this or try this medication? So they are taking a second opinion without jumping into something so drastic, Or he will say, yeah, you need surgery. You're right. Your physician is correct. You need surgery. But what happens now is that people from those countries travel. They buy, visas and everything, and they travel. And basically, what they do is they come on board and they travel, and basically they say, okay, we need to see a doctor. In that case, the doctor basically will be able to give the same opinion, which he's giving over the phone through telemedicine, face to face. So they see the doctor face to face, just like you and I are talking right now.
Yeah.
How the technology is, the doctor already is reviewing the file, and basically the file basically is telling the doctor what the diagnosis is and what the cure is going to be. So what that basically means is that doctor will be able to guide the patient.
Have you ever experienced technology issues with your software, and how do you navigate those when you don't directly control, the interaction between the patient and the doctor?
No, we have an online support system. And the only time we have noticed is that when there is some kind of technology, like you're talking about issues with the technology, correct? While they're talking.
Right.
Yeah. Sometimes there's like internet connectivity issues.
That's right. So how do you troubleshoot around that?
Yeah. So there are ways, we have an online support team. Basically, the doctor can either text them or call them or email them, and we can jump on board and then try to diagnose it. Like, for example, I can give you a good example. When we started, our first client was a remote center in Texas. And it took us a while to fix their issues. And we found out in the end that they were using some satellite internet connectivity, because they didn't have a cable, they didn't have fiber, they didn't have anything. All they had was a little satellite dish, and sometimes it was getting cloudy, and that's when they were losing connectivity. So those kind of things pop up, but now internet is pretty accessible, especially the phone. As long as you can connect via phone, you have data. That's all we require, and we don't even require too much bandwidth to do a video call.
Great. I want to start sprinkling in some questions that are kind of natural in our conversation flow from investors. One question here that I was actually going to get into is actually from Sandeep about your competitors. So Sandeep mentioned specifically, how are you guys different from Teladoc or MD Live? If you're familiar with either of those two companies, do you mind sharing differences between yourself and your competitors?
The Teladoc basically has a model which is very different than ours. What they do is they have physicians signed up, and physicians open up their slots on a daily basis. So they say, oh, I'm available between 1 and 3, or 3 or 5, whatever. And then they have a pool of patients coming in. So basically, they connect the patients to any random doctor, whoever is available at that time. The patient doesn't have any say that they want such and such doctor. The patient doesn't have anything. And basically, we are converting actually some of the customers from Teladoc who are coming on board with us, because what they want is they want their patients to be seen and their patients to be connected to them directly rather than randomly picking up patients left and right. And the second thing is that they pay very little. I mean, I'll be very upfront with you. Teladoc pays $26 a session with a patient to a doctor. I mean, for a whole session, the doctor only makes $26. With our technology, what we are doing is we are empowering them to charge whatever they feel is the right money and be able to publish their own times so their patients can connect. Same goes with MD Live. Teladoc is one of the biggest telemedicine providers right now, but their model is totally different. We are going after the small to mid-sized practices. We are empowering them to create their own schedules, give their own time slots to their patients, open them up for other patients. And on the other hand, Teladoc basically has a pool which they randomly select.
Got it. And that goes into the next question from Sandeep was, how much do you guys charge patients and how much do the doctors get from it? You mind talking about the margins there?
Yes. So our model, as I mentioned, requires zero payment from the patient. We don't charge anything from the patient, no commission, nothing. And the doctor has set fees. So when the patient makes an appointment, the doctor has either a copay through insurance or a cash pay. Those are the only two ways you can do it, correct? So we collect the payment and transfer that payment directly into the doctor's account. We have no idea. We don't charge any commissions on the doctor side or the patient side.
Great.
No
And
flat fee. Yes.
One question from Helen about margins as well.
Yeah.
Helen goes, can you comment on your margins? Many health tech companies are capital intensive and require frequent and large rounds of fundraising. How are you different in terms of margins?
Yeah, so let me pass you to Kashif. He's our accounts guy also, so he will be able to answer this question.
Hey, yeah, I was giving company to Adnan today just to assist him answering few of the questions. So basically, our revenue model is a little bit different than the rest of the companies, where we are creating few of the revenue pockets, which will be funding this company in future. One pocket is the subscription, as everybody know, like we publish on our campaign page. But other than that, we are working with partner organizations where we are connecting them on our platforms. For example, the pharmacies to put medicines on discounts, the labs to set us the wholesale rates for the testing services, and then we can, have certain margins there. And then there are a few more like where different these healthcare providers are coming on our telemedicine platform, and then we are offering this telemedicine platform to our to the patients via our customers. So it's kind of a B2C model where we are making money, but on the consumer area, we are just tapping the larger population so that it will grow like Uber did or Airbnb did. Not looking into just one thing, being a service provider ourselves, like Teladoc did or MD Life did. So, I mean, little bit innovation in the revenues as well.
Great. So, along that line,
back to Adnan. Yeah.
Yes. Great. Along that line, Adnan, what types of insurance do you accept on CallingDr? It's a question that Stephen asked.
Yeah, so the CallingDr, the provider has insurance, control. So if the provider has an agreement with one of the big fives like Cigna, United, Blue Cross, whatever, so if they have that, then that's all they need. They need to get some kind of authorization. And so we don't accept any insurances. We just pass that to the doctors. See, we're connecting the patient to the doctor. So now if the doctor is accepting that insurance, then
That's basically what they'd accept.
Yes.
Got it. Got it. Another question from Stephen that you touched on a little bit, but I think is important for investors and customers to understand is what type of security measures do you have in place to protect a patient's medical records?
So we have the highest level of security possible at the moment, and it's all high-tech and HIPAA compliant. So far we are lucky and we're blessed that we have a good multi-layer firewalls, so nothing has been breached, and we intend to keep it that way.
Got it. Great.
This is the highest level of security you can get these days. So that's what we have.
Great. And then one last question from the investor audience so far comes from Brian McDaniel. A little bit specific about your operations. Brian says, given the number of reps, I was curious if you can talk about how the sales team is compensated and how successful they've been thus far. I think you spoke a little bit earlier about your sales force. He's interested in learning how that's going.
So that's a good question. So we have two tiers of Salesforce. One is what we call on payroll plus commission, and they do the direct door-to-door sales. And then we have another one who are just based on commission, because these are people who are part-time or they want to do it on their own time, and they prefer it that way. We do have good commission model, very, very generous commission model, and it's they are getting paid throughout the contracts. If the contract lasts 10 years, they will be getting paid for 10 years on that contract. So we are very generous. Plus, we offer stock options to the sales force. So our sales force is very energetic, very focused, and basically we believe that direct sales is the best way to do it. Some of them are going through training. So when I mentioned 30 of them, most of them are getting trained right now, because you remember we just raised this money and we start utilizing that towards our sales force.
Great. And that was one of my next questions. Is primarily the money used, the money raised on StartEngine, that's going to growing out the sales team and acquiring businesses?
Yes, that's correct.
Got it.
And we have the breakdown on Schedule C. If some investors want to go and see our breakdown for utilizing the money, is all documented in Schedule C.
And if you raise the maximum of the $1 million, how many salespeople do you plan on implementing? What does that projection look like?
I think we will be able to get about 60 to 70 salespeople, and maybe even more, because the thing is that we have a team actually who does the calls, and they open up the door for the sales force to get in. Once the salesman or salesperson gets in, then he has to show demos, show the use of this product. And most of the physicians right now, since they are not aware of this technology, so what they are saying is that what they are telling us, that they don't even know telemedicine exists and if they can use it. So this is more like an educational stuff for them too. So the salesperson has to go and sell the idea, show the benefits, train the doctor's office, and then get them going. So it takes a little while, but once they get in, they love it, because that's an extra revenue for them and for their help to their patients.
Great. And so
the sales director, actually, his name is Ryan Anderson, and he's basically in charge of managing a sales force. He has extensive experience in healthcare and managing sales teams.
Great. And just a follow-up question. Sandeep is asking you to clarify your revenue model. It's making do you make a fee off of the money that's charged to the doctor? And how do you, and can you share your current revenue numbers to date?
So yes, so I will be able to share the generic, like I can easily say that, we are in the 6 figures right now as far as the sales are concerned. We have a flat fee model from the physicians, but that's not the only revenue our company generates. Finding Doctor will generate revenue by connecting patients to the doctors because the doctors will pay for that service. And then we have white labeling services.
Mm-hmm.
Now, white labeling services can run anywhere from 15,000 to 30,000, depending on how much you're doing, plus a recurring revenue on supporting that platform. So we have done a couple of white label projects too. So basically, and the premium apartment, which we are talking about, we will be able to charge hefty amounts from the doctors when the patient gives them. So let's say the premium appointment costs $300. We will be able to charge $25 or $50, even $50 to connect that patient to the doctor.
And so what do you project the percentage split of your revenue from the white label and recurring revenue models versus the flat fee from the doctors?
Right now, white labeling is about 10 to 15%. And the CallingDr, you can say about 70%. And then Finding Doctor is up and coming. Very few physicians have signed up. But as it gets more and more integrated with CallingDr, because our ultimate goal is to integrate the two platforms. That's when we feel we will get a big jump in revenue, because we are not only bringing a patient to the doctor, we are connecting the patient to the doctor, getting the fee on behalf of the doctor from the patient, whether it's a copay or insurance pay, and then giving them more access to the physicians. So we have signed up with the PNC Merchant Services in the whole United States, and any physician who signs up basically opens up an account with them, and the money gets deposited directly every night, in their accounts.
And when you talk about Finding Doctor versus CallingDr, if I'm investing in your offering on StartEngine, is that entity, do they own both CallingDr and Finding Doctor? Investors have some questions about, are they two different types of companies? What am I putting my money into?
That's a great question, actually, and I think I answered that on the website too, but I'm glad you brought it up. Basically, they are investing in the company called MyApps Corporation. It's a C corporation. It's a company. Any product, what I'm talking about now or in the future, which this company will develop, they are becoming shareholder in that company. So they will get benefits from all the products, whether it's these two products or any other product in future.
That includes CallingDr and Finding Doctor and Visiting Doctor.
If I have an opportunity, I want to show you something. Like, we are doing integrations with these devices, to test for the doctors, to test and to basically capture information, and stethoscopes and things like that. So all this stuff, we have a proper integration team. So we are doing hardware integrations like with iWatch, and I just wanted to share it with the shareholders that it's so extensive that our campaign is kind of outdated now on StartEngine, because we did it like a few months back. But there's some exciting stuff. For example, we are developing an intraoral camera for the mouth, for the dentists. So they'll be calling doctors for like teledentist visits. And that camera will have our own technology, our own branding, and we will integrate with the product. So to help sell this product to dentists. No one is paying any attention to the dentist thing. They will get benefit from all these products and innovations. So they are investing in this innovative company, not just one product.
Got it. Great. One question from maybe an international investor is, are your services available in the Africa region, or do you have plans to expand to that region?
Yes, so in the last ATA conference we went a few months back, there were a lot of customers, doctors, even administrators who came from Africa. And they basically showed a lot of interest in this product. And we are talking to them. Some of the challenges I think they are facing on their part is the internet connectivities and things like that. But this is up and coming. I mean, I don't see this long before we go in that region and help out the patients there too. Yes. Especially for second opinion, that's a great opportunity for second opinion. Even if they don't do locally, their patients can access, surgeons and doctors and specialists anywhere in the world using this technology.
Great. Last question I have from the audience before I want to wrap up with a few of my own. And please, for the investors still watching, please continue to send in any questions. We still do have time. One from Eileen here. Have you been keeping track of the changes in Medicare reimbursement for telemedicine, and how do you see that impacting the company?
Yes, so we do have a great question, actually, Eileen. We do have a whole department which basically is looking into all the reimbursements. There is something called CCM, Continuity Care Management, RPM and stuff. So they are giving a lot of money back now, Medicare. $45 a month per patient for continuity care management, for example. So we are talking about 2 or 3 actually companies who do continuity care management, and we will be integrating our products with them. Just like I think Asha mentioned that we are integrating with home labs and home medicine delivery. So our platform is end-to-end solution. So what that means is that if the patient cannot leave the house, they will be provided with the medical kits like lab kits delivered at home, and then they can just ship them back, and the results will be delivered to their doctors. So yes, so there are reimbursements coming, and Medicare Home Advantage, January 1, 2020, the bill has been signed by the Congress and the President, and it's already in force. So from Jan 1 of 2020, there will be full reimbursements for home advantage Medicare.
Great. A follow-up question from Helen is: when do you expect your company to reach profitability?
So from the current projections, what I feel is that in 6 months' time, we should break even, so with our expenses and stuff. Because as we are creating the sales force, they're bringing more and more customers. That means more revenue and more white label projects and things like that. So 6 to 7 months, we should be 6 months, we should be breaking even. And the 7th month, we are projecting that we should be profitable.
Great. And I want to wrap up with a few questions to talk about CallingDr's future. Where do you see CallingDr in 1 year's time and in 5 years?
So in 1 year's time and 5 years, our goal is to capture as much market as we can, and not only just capture the doctors who are offering these services, but provide healthcare access to all. What that means is that we have remote patient monitoring, we have other stuff. It's just like a Uber of healthcare, so everything has to be done and by us and given an opportunity for patients to use and physicians to obviously avail. Now, remote patient monitoring is home healthcare, long-term healthcare, nursing homes. No one is paying attention to this, but we are one of the only few, actually, as far as I can tell, we are the only company who have done full integration with an EMR called Point-Click Care, PCC. That EMR is extensively used almost by 95% of nursing homes. They have a monopoly in nursing homes, and we have done the bidirectional integration with them. So we are focusing not only on general practices and small to medium-sized practices, but we are getting into home health, nursing homes. So our growth is, I feel, is exponential. And like I said, the market is wide open. 99% of the market is available, and only the 1% has been tapped so far.
What does success look like to you? Is it a percentage of market share, or is it a milestone that you hope to hit with the business?
I think a combination of both. It's giving us a lot of satisfaction when we are helping patients in areas where they have no access, and we are giving them accessibility. So, the more of these areas we tap in, the more satisfaction we get, the more market share we grab. So it's a combination of both.
Great. And last question for me that I know the investors want to hear is, what does the exit plan look like for investors?
So the exit plan can be, I would say, like a couple of options. I have not looked into, this is seed investment right now, correct? We are at the ground level. So I think this is the best time to be in. Whoever is bought in and who are one of the followers who are thinking about investing, this is the time to get in. Because after this, once we close this offering, obviously the valuations will go up, because when we went to with your platform on StartEngine, we only had 20 practices. Now we have over 50 plus, and we didn't have any products like CallignDr. Now we have those. So to answer your question, yes, we are going to grow, and either some big company will come and say, oh, you are too much in our space, and they want to buy us out, or we can merge with a big company, or we can go IPO in 3 years' time, 3 to 5 years' time. So there are multiple options, and we leave it open. We are doing lots and lots of integrations. Excuse me. So that I will tell you, there are a lot of big players who are looking at us right now.
Great. Well, thank you so much, Adnan, for joining us. Thanks for taking the time. For the investors who are still with us, please, if you have any other questions, you can go to startengine.com/CallingDr and ask a question directly on the campaign page. I know Adnan is on that page constantly looking to answer questions from his investors. Again, Adnan, thank you so much for joining us, and thank you, investors, as well.
Thank you all. Thank you, Ella.
All right. Take care, everyone.